Turning to tonight's special edition of Homefront. For decades, service members have self-medicated to try and deal with the effects of war. Two veterans I spoke with went down that road and now see medical marijuana as a better alternative to dozens of prescriptions. These opiates that were prescribed to you by the VA?
No, they were non-prescribed.
Non-prescribed, okay.
Yes, sir. Started off with experimentation, and I'm like, oh wow, this numbs the pain and helps me deal with life, and makes me feel normal. So
helps you forget about Iraq.
Yeah, exactly.
Nicholas Schneeder, an infantryman with the Ohio National Guard, soon spiraled.
It all came kind of crashing down, and I ended up in the hospital, and I said, all right, this is it. I need serious help.
So you're medically discharged?
No, I got a general under honorable for using cannabis to treat my PTSD.
Robert Kowalski says he was trying to fix what the medical doctors in the Air Force couldn't.
I reverted to cannabis just for the strict thought that it was going to help me sleep at night. I was like, if I could fix my sleep pattern, then I could show up to work and perform the way I was supposed to.
The nightmares and memories on top of the medications were keeping both men from living a normal life.
How many different prescriptions? Can you name some of the prescriptions that they had you on?
Yeah, as far as a number, I've probably been through about 13, 14 different prescriptions for mental health alone. You always hear vets say, oh, I don't want to get on those meds because they make me feel like a zombie. That's exactly what Seroquel was doing to me.
They took my weapon away from me, put me in a back office job, so that took me completely out of my normal situation altogether. And it was just a spiral out of control trying to get the mental health moving on top of all the medication that they were trying to give me, and then getting in trouble for taking said medication. It was just too much.
What I found is that when we add medical cannabis to their regimen, the quality of life is better, pain is better, and although we may not be able to completely stop conventional therapies, we are able to wean the doses of those down.
James Weeks is an internal medicine physician who opened One Heart Medical in July, now specializing in the recommendation of medical marijuana in Ohio.
15% of my patients are veterans, and they range from mid-20s to 60s, 70s. And the majority of the time when those patients are coming to the clinic, the reasons that they're seeking help is for PTSD and chronic pain.
Shout out to the VA. It's been a blessing. It's really turned my life around.
The VA may have helped Nicholas with his addiction treatment tied to opiates, but the VA not only doesn't recommend medical marijuana, it won't pay for it and sees it as illegal in any form. Nicholas says he does discuss his use with his physician at the VA, and after his first month on medical marijuana, he notices a difference.
I call it a great supplement. So it doesn't replace everything, specifically, you know, therapy and things like that. Honestly, it has been a saving grace in a sense. It's allowing me to get off of pharmaceuticals that, you know, have really negative side effects.
I was utilizing Arizona's cannabis program and have found that smokable is the best form of relief for me. So I was able to stop taking all the prescription medications within the first year of using, and eventually came back to Ohio to assist a family member.
But for Robert, navigating what he sees are the benefits of marijuana is legally now more of a challenge.
I currently don't have my medical card.
And the reason behind the decision is based on losing his Second Amendment right if he does get it.
If we're calling it a medication, why do I have to choose between my medication and my ability to own a weapon?
Currently, there's no official tracking of the number of veterans using medical marijuana. There's also no indication at all that the current administration or the Department of Veterans Affairs plans to change its policy. For now, it's an out-of-pocket expense that is costly, but both Nicholas and Robert say the price is worth feeling better. And there is so much more on this discussion between myself and Dr. Weeks, as well as the two veterans. You can listen to the discussion on the Homefront podcast. Find it on Stitcher, Google, or Apple Podcasts.